Hi, this is Dr. Derek Mahoney welcoming you to visit the EODO booth at the ADX in Brisbane. Unfortunately, I won't be attending the ADX because I have some lecture commitments in Melbourne. We are proud to announce though that we are in the process of building a new EODO lecture centre and orthodontic facility in Brisbane, and that will serve well for students in the future who want to do their clinical component without having to travel to Sydney or to our other teaching centre in Melbourne. As far as what 2023 holds for EODO and full face orthodontics, I'd like to announce that next year, the mini residency in orthodontics, which is our 3-year program, we have sold out. Because of COVID, a lot of people have come back and have registered to start the course in 2023. If you want to start learning orthodontics and you don't want to wait till the 2024 intake, my suggestion is go online. We've taped during COVID all 18 modules and you can do them at your own pace. The website is eodoteachable.com. The clinical you can then choose to do in a number of locations at this stage in Sydney and in Melbourne, but in future also in Brisbane. So we welcome you to wait till 2024 and do the course live with me, but you could put your name on a waiting list. Sometimes people drop out, pregnancy, divorce, dare I say, all those sorts of things that disrupt our life. But at this stage, we are oversubscribed for the 2023 orthodontic intake. Now, let's talk about clear aligners. Last year, we ran our first 18-month program in clear aligner therapy, was very well received, again, oversubscribed. So we're running that course again in 2023. It's starting in July. That is 6 modules and will suit anyone who's learning clear aligners. Doesn't matter which brand. We don't push Invisalign or Spark or ClearCorrect. We push biomechanics, how to get yourself out of trouble, how to diagnose the case properly, the parameters, when do you expand, when do you distal drive, how do you set up your attachments, which attachments do you use? If the case is not tracking well, how can you cut your aligners, put some buttons and elastics on? If the case is not finishing well, lateral open bites, what are the tips in that regard? So speak to the students who've done the current intake. They love the course and we love teaching it. I'm doing that course with my colleague, Dr. Isabel Drooling. So the two of us will be presenting in 2023 in July onwards. Again, it's a full comprehensive clear aligner program. That we do have spaces for at the moment. What else is coming up? We're bringing in, now that the borders have opened, some good overseas speakers. In particular, Dr. Perdomo is coming in February, very good on biomechanics. That'll be in Sydney, 2-day course, and it'll incorporate how to place TADs with a hands-on component. A lot of people have been asking me about One Moon and the MSC technique. Fantastic technique to expand in adults and avoid surgery. One Moon will be coming live to Sydney next year, so please visit with Patricia at the ADX EODO booth, and she'll have a brochure for Perdomo's lecture, for One Moon's lecture, for our clear aligner mini residency. She will have the brochure for the full 3-year program, which has put EODO on the map, but unfortunately, because of COVID, we're oversubscribed for next year for that program. But there are spaces. We're taking registrations for the intake February 2024. My personal email is info@derekmahoney.com. If you have any questions, please feel free to email me directly for clinical information. I invite any student, before they commit to a program of teaching with me, to come and hang with me one day in one of my clinics. I'm very good at what I do. You'll see the passion in not just the way I teach, but in the way I treat patients. Because ultimately, you can't teach unless you're in the clinic and you have a high patient workload. So come and see one of my clinics in action, meet some of my instructors. My instructors also work for me. We keep it very clinical. There's not many programs available in Australia and New Zealand where there's hands-on, you actually treating patients under supervision. We offer that as a point of difference. There's theory lectures, there's typodonts, There's live patients. We help you with your own cases, whether they're clear aligner or fixed braces, or early treatment or airway, to be the best you can and offer your patients an amazing service within your practice. So thanks for listening, and I hope to catch up with you at some stage after the ADX.